Welcome to Chapter 3, when we start talking about biological and neurological factors in the development of criminal behavior. Hope everybody had a good weekend and back at it for another week. So, when we are talking about what we're covering in this chapter, we are talking about the neuropsychological deficits that can come into combination with a variety of risk factors, and that these are often found in antisocial or criminal offenders, especially persistent, serious, violent ones. So neuropsychology deals with the research and evaluation of normal functioning and dysfunction of the brain and subbrain regions as they relate to behavior, cognition, and emotions. As we will discuss more throughout this chapter, there are definitely some factors that come into play and can kind of create a little bit of a perfect storm to head towards that criminal behavior and especially serious criminal offenses. So when we're talking about neuropsychological factors in the context of our work and what we're studying, we're really talking about some different things that are really important in the neuropsychology. So the first one is self-regulation. Self-regulation skills are defined as the capacity to control and alter one's behavior and emotions. So being able to control and shift emotions, especially anger and temper tantrums, is a pivotal skill for being pro-social and avoiding aggressive or violent behavior. This self-regulation skill, as you can see in the table that we're looking at here, develops early. First starts to emerge around age 2. There are some genetic and neurological influences, although this is chiefly learned through socialization. So going back to our parenting styles, the authoritative style with parents who are sensitive, warm, and also firm with boundaries tend to demonstrate a higher level of being able to help children learn this kind of self-regulation. So an example of self-regulation is a child or an adult who avoids temper tantrums when things do not go their way, or an adolescent who refuses illegal drugs offered at a party. Followed up by the concept of executive function, and this refers to the higher levels of cognitive processes that organize and plan behavior, execute goals, and appropriately manage risk. Executive function is really an umbrella term for high-level cognitive control functions that are involved in all complex mental activities, and so therefore are of really particular importance to human behavior. Executive function also prioritizes steps necessary for solving problems and is closely involved in goal-directed behavior and the identification of alternative courses of action. So in comparison to self-regulation, which are mostly learned, executive function appears to be more neurologically based, and its development depends largely on the neurological growth within the prefrontal cortex of the brain. So the prefrontal cortex of the brain, I want you guys to kind of start thinking about as being like the chief executive of your brain function. It's the prefrontal cortex is sort of the newest, if you will, when we're talking about evolution and development of the brain, is sort of the newest level of the brain. So its job is to really regulate the other parts of the brain that do not have the same ability to do things like think through difficult situations and weigh out consequences. Things like morality and ethics, those live in your prefrontal cortex. Interestingly enough, the prefrontal cortex really doesn't reach maturity until around age 25. And really recent studies have shown that it could be even later than that for males. So when you're thinking about the frustration that you feel with your teenage student or your teenage child or somebody like that, when they aren't able to make decisions based on long-term consequences, that's because literally they do not have that part of their brain fully developed yet. So I always like to think about that and kind of the expectations that we put on people who are really young and don't have that entirely complete structure in their brain available to them. Also, when we're talking about executive function, deficits in this can result from malnutrition, exposure to environmental neurotoxins, brain injury, and prenatal exposure to drugs, nicotine, and alcohol, which we are going to go over in more detail later on in this chapter. And if you already read the chapter, then you already know. Then, one of my favorite things to think about in the study of psychology really is neuroplasticity, because I think that this concept is incredibly hopeful. And basically what neuroplasticity is we have discovered that your brain has a remarkable ability to change and shift and create new pathways. When you think about people who are able to be in years of serious substance use addiction and then have, lots of solid years of sobriety, that's a good example of your brain literally learning how to do things differently and creating new pathways. The same thing is true when we talk about using cognitive behavior therapy to help people work through depression and anxiety. And used appropriately, cognitive behavior therapy, because it's creating those new pathways in a person's brain, has been shown to be as effective as psychotropic medication for anxiety and depression. So, of course, nothing comes easy. Nothing worthwhile comes easy. So in order to create those new pathways, because also the brain likes to stay where it is, and I think we can all probably relate to the fact that change is very hard for people. So it's hard. So to create and forge those new pathways is actually really difficult and takes a lot of commitment, which is why oftentimes it's a hard thing to do. So children and adolescents seem to have the most neuroplasticity. However, even older adults can have shown a lot of promise in their ability to create and shift neural pathways. So really cool. Like I said, I really love neuroplasticity and the hope that it gives to changing negative behaviors. Okay, so genetics and antisocial behavior. I think as I was reading through our chapter this week, I was thinking that a lot of this feels very intuitive. Like it doesn't seem surprising that both genetics and environment would play into the development of antisocial behavior. I think it's interesting to look at the studies that have been done, though, to verify that that is real, and then also kind of detail maybe some of the really important findings about how those things come into play. So behavior genetics is the role genes play in the formation and development of human and animal behavior. So this is really the branch of biology that investigates the relationship between genes, and it has the advantage of clearly distinguishing genetic from environmental influences and estimating their relative magnitudes. The method used in behavior genetics is especially powerful for disentangling genetic from environmental influences in twin and adoption studies. So this is really important because when we're thinking about, looking at these different factors, it's important to be able to narrow out and single out the behavior from the genetic from the environment. And then molecular genetics. It's a field of biology that studies the structure and function of genes at the molecular level. So, contemporary molecular biology has focused on specific genes as foundation for certain patterns of behavior. And it really studies how the genes are transferred from generation to generation, which we're going to talk more about, kind of that generational link. Okay, so behavior genetics. 3 sources of behavioral differences. First of all, we have influences attributable to genetic effects, influences of environment shared by siblings, and influences from unshared experiences. So these are really important factors to think about when we are going to start looking at some of these studies of twins. The studies of twins, really the outcome, as you can imagine, right, when we're talking about research and studying environmental versus genetic factors, twin studies are really important because of the shared genetic code of twins. So one of the things that's important to think about, though, when we're talking about the study of twins is that, as we all know, there are 2 types of twins, fraternal and identical. So fraternal twins are developed from 2 different fertilized eggs and are actually no more genetically alike than non-twin siblings. So then they are, though, still important in this study because they are equally susceptible to prenatal environmental influences like substance use or neurotoxins, because they are, of course, being developed at the same time in the womb. So that's why, although they share a different genetic code, they are still useful in these studies. And then identical twins develop from a single egg, and they are always the same sex and share the same genes. So then presumably, if genes are, concrete in determining behavior, identical twins should display highly similar behavior. And if they do not, we may infer that behavioral differences are due to environmental factors. So one thing to consider when we're talking about this, to kind of further complicate the matter, which I thought was a really interesting point, is that not all twins develop in the same chorion, which is the outer membrane enclosing the embryo. So then some identical twins develop in slightly different prenatal environments, which could contribute to some individual differences. So again, still not 100% absolute in the ability to say they're exactly the same, right? So when we are looking at the study of twins, we're looking at, of course, when we're talking about the interaction between genetics and environment, we're looking at shared environments and non-shared environments. So shared environments, sometimes referred to as common environments, include prenatal and life experiences affecting both twins in the same way. So, for example, twins raised by the same biological parents share a common hereditary and home environment. Shared environments in this sense are apt to promote high trait or behavioral similarity between twin pairs, as you can imagine. And then non-shared environments are living experiences that are different for each twin, such as one being raised in a different home than the other, participating in different activities, or going to different schools. So when we're talking about, again, kind of like keeping the studies of twins valid, we want to make sure that we're taking into account if the environment is shared or non-shared, as that can really, of course, alter the outcome. Another important term when we're talking about studies of twins is the term concordance, which is the genetics term for the degree to which related pairs of subjects both show a particular behavior or condition. So usually it's expressed in percentages. So assume that we want to determine the concordance of intelligence among 20 pairs of identical twins and 20 pairs of fraternals. If we find that 10 pairs of the identical twins have approximately the same IQ score, but only 5 pairs of the fraternals obtain the same score, our concordance is 50% for identicals and 25% for fraternals. The concordance for identicals would be twice that of fraternals, suggesting that hereditary factors play an important role in intelligence. If, however, the two concordances were about the same, we would conclude that genetics is irrelevant, at least as represented in our sample and measured by our methods. And numerous twin studies using concordance method have indicated that hereditary may be a powerful determinant of intelligence, schizophrenia, depressions, neurotic disorders, alcoholism, and criminal behavior. Okay, so starting to look at some of these twin early development studies, twin studies. I'm going to start with this one. So the outcome of the twins early development study, or as it's abbreviated, TEDS, explores behavior problems as well as problematic development in language, cognition, and academic abilities from early childhood through adolescence. The outcome of this study was that heritability seems to play a modest role in antisocial behavior. And the research really indicated that when we're talking about nature versus nurture, right? So nurture being environment, nature has considerable influence over some behavior problems or disorders. One feature that goes along with personality, antisocial personality, is called the callous unemotional trait. And this trait seemed to have very high genetic heritability and little shared environmental influence. So the callous unemotional trait pattern, which we'll revisit again in a later chapter, is characterized by a lack of empathy and compassion toward others, and that results in severe and chronic antisocial personality. So, antisocial behavior. I think I do that every time. So that's a really important thing to take away from this study, is the callous unemotional trait being having high heritability. And then again, kind of the outcome of the study, the interaction of biological factors and emotional influences coming together. So the environmental risk factor in the study was the amount of maltreatment the child reportedly received from parents, because research shows that early maltreatment through a series of cascading events often leads to antisocial personality. So they discovered that the effect of maltreatment on the risk to develop antisocial behavior was strongest amongst those at higher genetic risk. In other words, those children with a genetic predisposition to become troublesome and antisocial were especially likely to be that way if they were mistreated. So again, there's the genetic predisposition to something, right? And then you have to think about, the contribution of things that happen to trigger that predisposition. Just because somebody's genetically predisposed does not therefore mean that they are going to end up that way. We have to also look at the factors that influence that and push it in a certain direction. The next study is the twin study of child and adolescent development. And the outcome of this study, first of all, this was conducted using data from the Swedish Twin Registry. And they studied 1,226 twin pairs and employed a well-researched behavioral scale to measure parental reported aggression in children ages 8 and 9. They then asked the same group of children to report their own delinquent behavior 8 weeks later. They used both fraternal and identical twins in their effort to disentangle genetic factors from environmental factors. And they found that genetic factors played an important role in the early onset of aggressive behavior in children, but appeared to play a less important role in the development of delinquent behavior as reported by male adolescents. So when we're talking about early onset delinquency, higher genetic probability or higher genetic factors played a higher part in that, and then later onset adolescent offenders, more environmental. Okay, and then as you can imagine, another interesting way to study the the role of nature versus nurture would be adoption studies, because then somebody's genes, you know, are definitely coming into play since they're being raised in an entirely different environment than with their biological family. So the first of the adoption studies was carried out in Denmark in 1972 and explored the incidence of psychopathy in the biological relatives of adopted adults. So comparing 57 adopted adults whom he diagnosed psychopathic to a control group of 57 non-psychopathic adopted adults. The study's implications for criminal behavior are questionable because he defined psychopathy by his own loose criteria, and so that's not a great, that's not a great measure when we go back to talking about validity and reliability of research. That's not a great format to use because that's a very subjective, not objective. However, he found that 3.9% of the biological relatives of the psychopathic adoptees could also be classified as psychopathic, whereas only 1.4% of the control group's biological relatives could. So with those numbers, they just failed to reach statistical significance. So, being careful about accepting that implication. In 1974, Crow conducted a better designed study, a follow-up of 52 persons relinquished for early adoption by female offenders. 90% of the biological mothers were felons at the time of the adoptive placement, and most common offenses were forgery and passing bad checks. For the follow-up, he selected 37 control subjects and 37 index subjects who had reached age 18. The index subjects are those who are of major concern when we're talking about this research. 7 of the index adoptees had arrest records. As adult, all 7 had at least one conviction, 4 had multiple arrests, 2 had multiple convictions, and 3 were felons. Of the 37 matching controls, 2 had adult arrest records, and only one of those had been convicted. Then each subject's personality was diagnosed by 3 clinicians based on test results and data gathered in an interview without any family background included. The clinicians made their diagnoses independently of one another and without knowing the subject's group. 6 of the adoptees born of female offenders were labeled antisocial personality. 1 control group subject was labeled probable antisocial personality. So he found a positive correlation between the tendency of the index group to be antisocial and also 2 other variables: the child's age at the time of adoptive placement and the length of time the child had spent in temporary care, like foster care and orphanage. So as you can see, that's an interesting outcome, and that the adoptees, 6 of them born of female offenders, being labeled antisocial personality, and only 1 from the control group. So you can see definitely a difference there in the amount of antisocial behavior present. In 1975, we have another study that examined the effects of genetic and environment. So they said if there's a genetic basis for criminality, then there should be a significant relationship between criminal tendencies of biological parents and those of their children who are adopted by somebody else. So what they found was that there was a significant relationship between the criminality of the sons and that of the fathers. So where the biological father had a criminal record and the adopted father had none, a significant number of adoptees still became criminal. But where the biological father had no record and the adopted father had a criminal record, the number of adoptees who pursued criminal activities was lower. So that's a really interesting study to think about when we're talking about the role of genetics in environment. Because if the biological father is a criminal offender, much higher risk that the adoptee would also be a criminal offender, and then switched. So if the adopted father was the criminal offender and the biological father was not, then the adoptee had a lower chance. So that's a pretty important study when we're thinking about nature versus nurture. And then the last one we're going to go over is probably the most comprehensive adoption study to date. And they compared the court convictions of 14,427 adoptees in a small European country with conviction records of their biological parents and adopted parents. So the study showed a significant relationship between the conviction history of the adoptees for both male and female of their biological parents. Specifically, if either biological parent had been convicted of a crime, the risk of criminality in the adoptee, their biological child, increased significantly. This relationship was especially strong for male adoptees who were chronic or persistent offenders. There was not any evidence in that study, however, to suggest that the type of crime was the same amongst the biological parents and the adoptee. So in summary, the twin and adoption studies do suggest that genetic components may contribute moderately to a tendency to become criminal, but they've also found that environment is highly important. So that's the outcome of these genetic twin and adoption studies. That nature and nurture both play a role, right? Which again sort of feels probably pretty intuitive. Okay, molecular genetics is really when we're looking at specific genes, and if there are specific genes that predispose to a certain type of antisocial behavior. So the MAOA gene is instrumental in preventing antisocial behavior in humans. That we know for sure. What's very interesting is the other version of the MAOA gene is the MOAL gene, which is just a low activity gene version of that other gene, and this has been nicknamed the warrior gene. And when this gene is present, it's estimated that it's carried by roughly 1/3 of the population in some societies, and usually comes into play after some form of provocation. In recent studies, persons with this gene who were exposed to adversity in their childhoods were significantly more likely to report offending in late adolescence and early adulthood. This has been nicknamed the warrior gene, which I think is interesting when you think about, human history, and if certain people were sort of more predisposed to that aggressive behavior, and maybe those people were channeled more into the pathway of the warrior. So I think that's an interesting nickname. Okay, then we have psychophysiological factors. Psychophysiology is the study of the dynamic interactions between behavior and the autonomic nervous system. The autonomic nervous system is the subdivision of the peripheral nervous system that regulates involuntary functions. So if you've taken psychology, you remember learning about this. This is like heartbeat, blood pressure, breathing, and digestion, and is closely connected to the genetic makeup of an individual. Heart rates and electric conductance in the skin are the usual measures of the psychophysiological investigations examining the relationship between antisocial behavior and autonomic activity. So, studies have indicated that antisocial boys and criminal psychopaths do appear to have lower levels of physiological arousal. So when you think about that, you think about if somebody's nervous system isn't reacting in the same way, and they're not getting kind of that negative feedback from doing something that would produce fear or anxiety for somebody else, the tendency towards that behavior would be higher. I think about this when I think about a study I read specifically relating to anxiety, and that the study had indicated that people who were diagnosed with antisocial personality disorder, which is, sociopath or psychopath, they did not have the same anxiety response as other people. And when we think about the important role of anxiety when we're kids and we're learning what is right or wrong, we don't like the uncomfortable feeling of anxiety when we do something wrong as children. So then we learn to avoid that behavior. But if a child, physiologically doesn't have that same reaction, it would then follow that their ability to learn what is right and wrong would be hindered, because they don't feel the same level of anxiety related to it. So I think that this is an incredibly important piece, and I look forward to the continuing research about it. And then, so this kind of then falls into the importance of temperament. A child's temperament is defined as a natural mood disposition determined largely by genetics and biological influences. And when we're talking about this, we're talking about, even if for infants and very young children. And temperament, of course, no surprise, would be influenced by the environment, as we can all agree and imagine that how true that is, right? Okay, so Thomas and Chess kind of came up with these categories of child temperaments, and they contended that temperament is an innate readiness to respond to events and objects across a variety of situations, and also that temperament is continually evolving and is also influenced strongly by family, parental styles, and the social environment in general. So they asked parents to report on 9 characteristics of their infants, and then this is how they came up with this table that we're looking at here, the categories of child temperaments. The 9 characteristics were rhythm of biological functions such as regularity of bowel movements, sleep cycles, and feeding times, activity level, approach toward or withdrawal from new stimuli, adaptability, sensory thresholds, predominant quality of mood, intensity of mood expression, distractibility, and attention span or persistence. Based on these data, they were able to classify child temperament into 3 styles. We have the easy, the difficult, and the slow to warm up child. Important to remember when we're talking about these categories of temperament is that especially when we're talking about the first year of life, most infants, I would say, have difficulty regulating, right? And have some disruption in their rhythm of those processes, like sleep and eating, that kind of thing. So it's suggested that temperament increases or decreases only the probability of antisocial behavior, not that it determines whether an individual will or will not engage in antisocial behavior. When we're thinking about temperament, I think also we're thinking about how a child is treated, right? If you have an easy child, probably people's response to that child is very warm, very welcoming, all of those, very patient, those types of things. And for a difficult child, probably they're getting some more negative feedback socially. And so again, I think difficult then to categorize and say it's absolutely just caused by this temperament, because I also think, and as the book talks about, it's also very much impacted by the social dynamic and how the children are responded to. Okay, so now we're going to look at environmental risk factors. And when we're talking about environmental risk factors, we're going to talk about in utero experiences, especially, first of all, the presence of neurotoxins. Neurotoxins are trace elements, pesticides, chemicals, and biological elements that have toxic effects on the human nervous system. They may damage, destroy, or impair neurons or other brain-supporting cells, which produce changes in behavior, emotion, and cognitive ability. The fetus and children who are less than 2 years old are especially vulnerable to these neurotoxins. The first one we're going to talk about is lead. Lead, of course, used to be in gasoline. It used to be in paint. It's still in some water pipes. So it's still out, it's still around, and it is very clear from the research that abnormal levels of lead in the human body predict a variety of academic, emotional, and cognitive and behavioral developmental delay problems in children. Young children absorb lead more easily, and it also impacts them more strongly. So, of course, there's been a lot of legislation that's been passed to protect people from lead and lead poisoning. But prior to 1977, it was still being used in paint and was still in gasoline until 1996. So not that long ago. And then I'm sure you might remember the Flint, Michigan water crisis from not that long ago due to the lead poisoning there. This is also important to think about when we go back to talking about socioeconomic risk factors. Lead is one of them because there's a higher probability of neurotoxin exposure and lead exposure in inner city, low socioeconomic inner city communities. Okay, and then we have cadmium. And this has been linked to violent behavior in a number of studies. It does appear that extensive cadmium exposure during developmental years is related to learning difficulties and lower cognitive functioning in children and adolescents. And then that kind of, again, rolls into the learning disabled being more likely to enter the criminal justice system for delinquency and adult criminal behavior. This is present in rechargeable batteries. So it's very much present in our lives, in almost every electronic device that we use today. It's also found significant amounts in tobacco products. It can enter the human body through maternal smoking during pregnancy, postnatal exposure to environmental tobacco smoke, and exposure to smoke and particles from the burning of fossil fuels and the incineration of municipal and industrial waste. Then we have manganese. This is interesting because this is both an essential trace element, and then when its high levels of exposure are too high, it's a powerful toxin. So, interestingly enough, it causes, it really attacks the nervous system. So, excessive manganese accumulation in the nervous system results in poorer brain functioning, lower intellectual functioning, and a tendency toward aggression and violence during adolescence and adulthood. There's also some direct linkage between manganese exposure and welding, because of the metal that's coming off of the when people are welding, and the exposure that people who've been in the welding industry for a long time have had to that manganese. And then mercury. Mercury is toxic and damaging to the brain and other body organs. Human exposure to mercury really comes primarily from eating mercury-contaminated fish and marine mammals, and to a much lesser extent from dental fillings. There is no direct link of mercury exposure to criminal or antisocial behavior, but it just causes multiple negative effects on both human health and behavior. And it does pass through the blood-brain barrier to the developing fetus. So, again, when we're thinking about those things that can affect the fetus prenatal. Okay, so then protective properties. A protective positive factor is the presence of trace elements in the human body. They represent essential micronutrients, and these are just found in very small amounts. These include iron, zinc, iodine, selenium, copper, manganese, fluoride, chromium, and molybdenum. And adequate intake of these trace elements can directly reduce the harmful effects and accumulation of neurotoxins. So, important to take your vitamins. Here's the list of those neurotoxins that we just went over. That's on page 91 of your textbook, so you can take a look at that. Okay, and then when we're talking about, again, some of the things that infants and young children can be exposed to, even exposed to prenatal. So malnutrition is so important in the development of the brain, and malnutrition in children may really increase the prevalence of conduct problems and aggressive behaviors. There was a big study, the Barbados Nutrition Study, that really linked high levels of antisocial behavior in adulthood, and sort of the cumulative risk of consistent malnutrition. No surprise that exposure to nicotine, alcohol, and drug exposure in utero has very devastating effects on the developing fetus. Fetal alcohol spectrum disorder is sort of a term that umbrellas a lot of different health and cognitive neurological functioning issues, and is related to when the mother uses alcohol while she's pregnant. There are also studies linking the use of nicotine during pregnancy to slower brain development, as well as just the presence of secondhand smoke and how harmful that can be. There's also a link between maternal substance abuse and substance abuse by offspring. And again, I think up for debate about how much there's a genetic link to that or an environmental link, but probably both come into play. Another important issue to think about when we're talking about this is a traumatic brain injury. Of course, when we're talking about the prefrontal cortex, as we just were a little while ago, and how it regulates emotion, helps make decisions based on morality, plans all the long term, all that stuff. When we're talking about traumatic brain injury, we're talking especially traumatic brain injury that impacts that frontal lobe, tends to be the most damaging. And traumatic brain injury can greatly impact somebody's personality, can alter their behavior in drastic ways. Even if, physically they appear fine, it can absolutely change somebody's personality, and can make them a lot more, really predispose them to a lot more violence and a lot more aggression. Case of Phineas Gage, I hope you all read about that. And I think that there will be a video posted in this week's assignments for you to watch about that interesting case. Brain development abnormalities. The quality of the prenatal environment is important. The brain is really vulnerable to intrinsic hazards and external insults resulting from viral infection, drug or alcohol exposure, and other negative neurotoxins. Also, nutritional adequacy, like we just talked about, the brain really relying on folic acid, iron, vitamins, and other nutrients to develop correctly, and also talking about the limbic system. So the limbic system consists of a diverse group of loosely connected brain structures and circuitry, and it's a really important component associated with impulsive violence. The most important brain structure in the limbic system involved in aggressive behavior is the amygdala. And if you go back to figure 3.1 in your textbook, which is on page 82, you will see where the amygdala lies. The amygdala is small and plays a major role in learning, memory, and the experience of emotion. Impulsive aggression and violence appear to be related to activity in the amygdala. Okay, so neurotransmitters. The neurotransmitters are chemicals that are manufactured in the brain that are intimately involved in biochemical activity and transmission of messages throughout the nervous system. Of course, the big one, well, two big ones, really, but serotonin, I'm sure, well, maybe not, but at some point you've probably heard some reference to serotonin. Serotonin has been thought to be a very important neurotransmitter in the treatment of depression, and most antidepressants increase the amount of serotonin in somebody's brain. So low levels of serotonin do seem to be linked to more aggression. And then these other research, there hasn't been much research into these other neurotransmitters that play an important role in other functions of the brain. However, they are being studied and looked at to see if there are some direct links to criminal behavior, aggression, violence, to these other neurotransmitters. Okay, that's it for this week. I hope you all have a really great week, and happy first week of September. And I will talk back at you next week. Thanks, guys.